Depending on the study, up to 70 to 80% of men have used pornography or use it regularly, and up to 32% of women. Interestingly, traffic to pornography sites increased by 11% during the COVID pandemic. And people use pornography for a number of different reasons: to increase sexual desire, to satisfy their curiosities about sex, and sadly, to learn about anatomy. Because let's face it, sexual education is limited, if not mediocre at best. Is pornography black or white, good or bad? Well, there's not one right answer for every person. On the positive side, people have shown that pornography users have a more positive attitudes towards sex. They may be willing to experiment more with their partners and have a more satisfied sexual life because of it. And in the moment, watching pornography usually causes people to feel good. And lastly, some studies have shown, particularly in women, that watching pornography increases their sexual satisfaction and libido. And people who watch porn with a partner actually find that they're more dedicated to their partner and more sexually satisfied. And I know a lot of people worry about watching abusive and damaging pornography and how that can cause maybe sexual violence, but there has been no linkage after looking at multiple studies with pornography and increases in sexual violence, rape, or assault. So when does pornography become a problem? Across multiple studies, up to 4 to 10% of people find that they have a problem with porn use or may self-identify as having a porn addiction. Medically, porn addiction is not a classified disease. What people in the medical field call it is problematic pornography use. So who's at risk for getting problematic pornography use? Watching more pornography does put you at higher risk, but doesn't in and of itself mean that you have a problem. Also, if you have depression or anxiety on top of watching a lot of pornography, that puts you at a higher risk as well. If you find yourself having moral incongruence or feeling that morally pornography is bad, you're more likely to have a problem due to pornography use. Lastly, if you find yourself preferring masturbation to pornography than having sex with your partner or a real person, then that's also a sign that you may have a problem. If you think you have a problem, you probably do. Watching pornography in people who develop this problematic pornography use have upregulations in pathways in our brain that cause us to look for these dopamine pathways over other things that we normally would do. So your brain starts developing cravings for pornography and even signs of things that may be similar to other addictive substances like drugs. For example, you may develop a tolerance. So you'll watch some pornography and you may need to find more novel, more aggressive, or different types of pornography to get the same sort of enjoyment from watching it. You also get impulsivity and compulsivity. What that means is you get strong, sudden urges to watch pornography and you compulsively do them. You keep repeating it regardless of the negative consequences that might occur. And you get what's called a weakened executive function. What that means is your brain, when it tells you to do things that are good for you, so like go to work, take a shower, pick up your kids from school, just normal activities, but when you have this pathway upregulated, you actually impair that executive function, so you're less likely to do things that you normally would do. And lastly, you can get dysphoria. And so what that means is that you start feeling very frustrated and unhappy in other parts of your life when you're not watching pornography. And all of this taken together can really impact your willpower. And willpower is actually not the best way to get rid of these cravings. So when all this is going on in your brain, what happens to people in real life? Well, you'll find yourself avoiding doing normal daily activities, spending time with family or friends, rather than going to work, finding yourself watching pornography instead. This can lead to social isolation, feeling very lonely and having very few connections. It can lead to financial problems where you're spending more and more money to use pornography, and it can cause problems in your relationships. More than that, people can find themselves getting signs of real mental health disorders like depression or anxiety, where you're feeling constant sadness or constant worry. Pornography, if you're not aware, is a fake product. It is not real life. This is not how normal sexual encounters occur. This is a highly edited product with lighting, with special effects, and all sorts of things that can make sex seem like something very different from what it really is. And quite frankly, a lot of pornography is aggressive, abusive, and doesn't show you how you actually need to pleasure your partner. These actors in pornography are not average people. They have above average length penises. They have special effects to make it look like they have higher volumes of semen. And they are immediately erect and women are immediately lubricated, which is not at all what happens in real life. The real issue with this fake production of pornography is people can start really having self-esteem issues. So they start thinking like, oh, am I good enough because I don't look like that? Or am I pleasuring my partner well enough because they're not responding like the woman on the porno video did? All of this taken together can lead to performance anxiety and issues with erections. If you're using pornography on a regular basis and getting strong urges to use it and avoiding normal daily activities like going to work or hanging out with friends, maybe needing more and more pornography to reach climax and feeling like you've lost control, these are signs that pornography may be a problem for you. So if you're in this category, what are some tips that you can use to help break the cycle? Well, first and foremost, you want to delete all access to pornography that you have. Delete all the pornography on your computer, on your phone, delete the websites, make sure you don't have access to them, and find an accountability partner. Find someone who will keep you honest in saying, did you use it today? And you're going to tell them honestly if you did or you didn't. Better yet, you could also get help from other things like apps. Blocker X is an application that can allow you to effectively block apps, websites, and other things on your devices that give you access to pornography. But the problem with most apps, unlike Blocker X, is that you can delete them or bypass them yourself. But with Blocker X, you also can choose an accountability partner that actually is the only person who can allow you to remove that app from your phone or computer. The third thing you can do is figure out the cues that are triggering you to use pornography. So take note of what's happening when you get the urge to use pornography. Are you depressed? Are you bored? Are you sad? Are you lonely? What exactly is causing you to feel this urge? Is there something that happens pretty routinely before you go watch pornography? The fourth thing is then identify what happens when you get the urge itself to watch pornography. How does your body feel? Do you feel kind of tense in your muscles? Do you feel your heart racing? Do you feel very uncomfortable sensation in your chest or your stomach? Take note of that feeling. That's your urge feeling. And once you've really figured out what that urge feeling is, identify it. Take note of it. Sometimes it can even help to give it a color or a shape. And so whenever you get the urge, you're like, oh, it's the purple dinosaur. You can't fight the urge. You just have to acknowledge it, know that it's there, and know that it will go away on its own, but it's going to be there. And so allow the urge and then let it pass. And as you keep practicing that, the urges will get less strong and less bothersome, but they will still certainly be there. You will never get away from having urges to do something that your brain has habituated itself to do. And lastly, now that you know what your cues are, your triggers are, and what happens when you get the urge, write those things down. So for example, if you feel depressed, write down, I feel depressed, and then I get the urge and I feel my heart racing and my muscles tense up. Then you go watch pornography. So that's your habit loop. Now you want to break the habit loop. So what are you going to do when you have that cue and that trigger? What can you replace with pornography? What else gives you dopamine or joy? Maybe that's going for a walk. Maybe that's talking to a friend. Maybe that's reading a book or taking a bath, or even just doing a quick workout like 20 jumping jacks or 5 push-ups, and maybe that will help you get a little bit of endorphin rush and avoid the need to use pornography. Lastly, realize that if you do watch it or if you do give in to the urge, don't beat yourself up. Be kind to yourself. Know that things will happen. It will not be a straight line, and just keep working at it. Keep writing those things down, keep practicing, and eventually you'll get over it.